So that's why control of high blood pressure seems to be very, very important, because mostly, most of the heart problem is caused because they didn't control the heart blood pressure nicely. Okay, and then 48% they have these high glucose or diabetic problem, 46%, and then 38% normally they are smoker, and then 37% they have high cholesterol. So from here you can see high cholesterol, high pressure, high blood pressure, and high sugar level in the body is the common. Okay, mostly they are combination. Mostly all the heart patients have these three one. Okay, and then the World Health Organization, they have study also. Mostly the death of attack of heart disease, 10.6% are because of the thickness, okay, of the heart muscle, and 7.6% maybe because of partial of the heart muscle got some problem. Okay, so this is quite a high percentage, and then normally is due to high blood pressure, and then it causes the change in the heart muscle, okay, which will cause later on cause some problem in the heart pumping. So from here we can see that the type of heart disease, there are so many types. Okay, so we are not be able to finish in one chapter. Okay, even though I just introduce, okay, very simple on all these things, but it still take me quite some time. So I won't talk about the what first. So next topic I will talk on this, and then the other one is this cardioarrhythmia. Okay, this one I wouldn't touch first because all these are related, and then it would cause very serious the irregular rhythm, irregular beating of the heart. Okay, and then today we will concentrate more on artery. Okay, this coronary artery, the most popular one. And most of the heart patients are having this problem. There is the supply of blood to the heart is getting lesser because of blockage of the artery. And then this what we call the aneurysm. Aneurysm is because of the growing of tumor also on the artery, which is quite rare, but it's very dangerous. And normally, if anything happen, blockage or any bursting of the this tumor or serious blockage of the tumor on the artery there, and then it affect the blood flow. So easily the artery also will get burst, and then sometimes it will cause a very serious problem because the blood cannot be pumped out, and then it increase the what we call the pumping of the heart, and then finally sometimes the heart will break also. Okay, so this is very serious, and normally have this kind of problem. Sometimes not only the heart, sometimes in the brain, in the big artery in your abdomen there. Okay, all this death very easy. If it happens, it will cause death very fast, or within very short times, you will go into coma and then death. Okay, so this is a topic which really affect the artery. So I will talk about more on this coronary artery, and then these three, what we call the heart failure, and then this cardiomyopathy, which is related to the muscle, okay, of the heart, and then this pericarditis, okay, which is related to the liquid, and then the layer of one layer of very thin layer which cover up the hard one. Then there's some liquid in between, and then sometimes it will cause, it will attack by bacteria, virus, and cause inflammation. And then it will make the heart go into a stage, okay, which it will beat irregularly also. Okay, so I will concentrate on that. So these are all related to Warfarin. I just skip first. Okay, and then this is the one which I mentioned just now. Okay, what we call the aortic aneurysm. Okay, this is what happened. This is the vessel, the very big artery. Okay, from your heart, which pumping up one, and then normally, okay, something went wrong. The aneurysm is happening here, and then sometimes it might grows up, and then you block the artery. Okay, and then this will happen not only on the heart, but on the brain. If the brain bursts out, then you cause stroke, right? Okay, a lot. Some of the patients, some of people, they might genetically have this kind of problem. Okay, the burst off will cause serious stroke, and then easily will cause death also. Okay, and sometimes it will happen in the very big artery, okay, in your abdominal there, okay, which will block some of the flow of your blood to your kidney or to your lower part of the body and affect your leg or those problems. Okay, so these are really related to artery, and then the treatment of this we have to go through serious what we call the surgery. Only we can really treat these problems. Okay, which I won't go into very detail. Okay, but hopefully mostly not so many people will have that kind of illness. Quite rare also. Most of it are very high chances genetically have this kind of problems. Okay, so I'll concentrate on this. Okay, this is called the coronary artery diseases. Okay, where the coronary artery, which is those vessels outside the blood, the heart. Okay, this is the heart, and then heart. There are a lot of muscle outside the heart here. Okay, which they need a supply of blood so that the oxygen and then the nutrient can supply to the muscle outside here, so they can nourish, okay, the muscle here and to bring energy, okay, to the muscle here. So it's very important the supply of blood so that oxygen and nutrient can reach here to make sure all these heart cells can function efficiently and very powerful. So there are three major, okay, blood artery, a very big one. Okay, once the bloods are coming out from the main artery here, then it straight away will branch into three. Okay, we can consider quite big also this artery. They are the main one. Then after that, it will branch into small one. Okay, and then the whole of your heart will be covered by all the small artery, capillary, and then the blood is delivered through this system. So oxygen and nutrient have to go through all this artery, and then it delivered to your cells. So in normal case, the artery is very clean, and then the blood flow can be easily flow, okay, and supply to the heart muscle. But what happens? Sometimes there are blockage, there are blood forming inside this artery, and then slowly it develop, it getting thicker and thicker, okay, and then slowly the pathway become narrow and narrow, and then your what we call the artery here, coronary artery, become hardened, okay, and then the elasticity is not that good also, and then finally sometimes you will get narrow as like this. So the pathway for the blood to flow to the lower part, okay, to the smaller those artery or capillary getting very low. So once the blood supply to all this, let's say here is happening, and then the below part, there won't be a lot of blood supply to the below part. So the muscle here will be able to get the oxygen and then the nutrient supply. So slowly all the muscle here will get damaged, and sometimes it will be spoiled. Okay, get death of the muscle, and then slowly it will cause the heart cannot pump properly. Okay, no strength. Okay, so normally here for a blood like this to develop, it will take a very long time. Okay, not easily will form like this. Maybe it will take you like 10 years or something like that. And then sometimes it's not only one part of your arteries blocked like this. Sometimes this what we call the atherosclerosis will happen. There is one of your artery, there might be a few places, okay, got blockage like this, or the forming of the blood like this. Okay, so forming of blood, what caused the forming of blood? We must study if we want to prevent this to happen. So earlier when I talked about high blood pressure, this cholesterol topic on this, I've already mentioned quite clearly, okay, why it formed. And then most of the time, earlier, I think 30, 40 years, okay, so far in the past, we have a misunderstanding on the forming of the plaque. We put all the blame on the what we call this saturated fat that we are taking. Okay, we are saying that all the animal meats, and then those coconut meat which contain very high saturated fat, which will deposit, and then easily it will get it will become what we call because like those vegetable oil, it will maintain in liquid form all the times. But however, animal fats, sometimes when the temperature is lower, or it will change from liquid, or it becomes what we call solid. Okay, it becomes solid, and sometimes when it mix with some of the pellet inside the blood there, and then some of the minerals and other cholesterol, and then easily it will combine together and become like crystal type, and then it deposit, and then sometimes it become plaques inside the blood there. Okay, so all the time we thought, okay, all these things are because of saturated fats, okay, because of fats which are no good that before. But these few years, scientists already discovered, because scientists really study, okay, after a patient attacked by heart attack, or maybe he died, again then they operate, and then they really go and study what is inside of this blood actually. Okay, and then they found out, okay, the blood is not purely made from this saturated fat. Actually, it forms due to the combination, okay, of the oils, the fats, and then all the pellet, even our red blood cells, okay, and some of the minerals, especially like calcium. Okay, so the formation, okay, sometimes the calcium nice, okay, of the blood cells, and then make it hardening, okay, because of some of this unnecessary high of those minerals inside the body, especially when we are taking too much of salt, those things which contain very high minerals. All these minerals, extra minerals, will combine with all those things like fats, okay, and then it form, okay, the plaque. But okay, so from there on, we understand that, okay, this piece of things is not only fats. Why it formed mainly is because inflammation is happening, okay, injury is happening on your artery, okay, and then when the process of repairing the injured places, okay, all our white blood cell, okay, they will carry all these pairs and then they will try to stop the bleeding or those, and then in the process of this, it have an opportunity, right, to let all those cholesterol, then they will go into the inner layer of the wall of your artery, the muscle here, and they make a formation of all these things. And then sometimes, because quite often when we have high blood pressure, or the flowing, or because the pressure is very high, the flowing of the blood itself, okay, those parallel, okay, red blood cell is hitting the wall of the artery, and then sometimes you injure the wall of the artery. And furthermore, sometimes inside the blood there, let's say we have some crystallized like urine acid, okay, which will cause gout one. Okay, those crystal, okay, sometimes it might be quite hard also, and then it when it flow together with your blood cells, then it will injure the wall of the artery. And then this causes inflammation, and the process of inflammation, okay, our white blood cell will give the delivery of all these fats and then the calcium just to cover back the wound there, the healing of the wound. And then sometimes the wound it didn't heal properly, or sometimes you will left up with scar or those things. And then later on, all those fats which are travel inside your blood, it will easily stuck there also. Then this layer of blood will get hard, thicker and thicker, and then those go inside the muscle. Then it will sometimes roll inside there, and then the wall, the whole things will expand, and then the pathway becomes smaller and smaller. So finally, the heart will form this type of plug inside there, and then the pathway becomes very, very narrow. Okay, so the supply to your heart of all this blood getting lower and lower, and then the heart muscle have problem, okay, later on. So what to cure this problem, normally how the doctor do the operation, normally doctor will put a balloon, okay, put a stent inside here, and then use the balloon to blow it, so to expand it, and then let the stent hold it, so that the artery will open back, and then they will put some medicine there to dilute all this blood. Okay, so in the process, okay, the remove the dilution, this dilation of the blood have to be done in a very slow process, because sometimes, okay, if the blood accidentally a very big pieces it suddenly drop off, okay, sometimes it will travel in your bloodstream and then go to let's say into your artery, got another part, let's say this part, okay, and this blood is coming out already, and then it travel, then it reach here, and then the blood will stuck here, and then totally no supply of blood go to your muscle here, and then heart attack will happen, and then you'll find the heart is acting in such a way that it will give you a very high pain, okay, which are normally what we see, okay, those people who have very severe heart attacks, okay, and then they will show, okay, they have to put their hands on the heart there, and then you can see how they are very painful, okay, even though sometimes most of the heart patients, they won't experience this. Okay, just for your information, myself, I'm a heart patient also. During my young age, around 38 years old, I went through a bypass operation because my heart is having this coronary artery disease. Three of these main artery block, and then there are this problem. Okay, this atherosclerosis. Okay, is happening in both in 3 of the artery here. So I can't go through the balloon process, or which we call the angioplasty. I cannot do angioplasty because of this. Or the artery, or one artery got so many places. Let's say got 3 places having blockage like this. So let's say 3 main one also got 3. That means I got 9 stent you have to put, which will not be efficient. Okay, in the long run, it will collapse back. So I got no choice. I have to go for operation. Okay, what we call the bypass operation. Okay, so they take a artery from my leg, then they bypass here. Okay, let's say here is blocked. They will stitch the artery here, and then they will bypass, and then the other side they will put here, so that another pathway, okay, where the blood can flow, and then it will reach the bottom part will get the blood easily. So 3 of my artery also got bypass. Okay, and then these are normally smaller than these 2. Myself, this one also bypass, because the doctor who are doing for me is a very famous doctor in Malaysia. There is what we call the doctor called Dr. Bao. Okay, in IJN, very famous one. So he operate, and then he are able to do, even though this artery is very small. Okay, they need a very good skill to stitch. Okay, to really do the bypass. The stitching is very, very important one. So the doctor need to have a very good skill in doing this, so that it won't bring you a lot of problem later on. So myself, I've gone through these 3, and then during the age 38, I'm having this bypass. Earlier, I'm an accountant. I'm not in this line. So after that, I've got no choice. And I find that if I didn't change my career, maybe after some times, or maybe after 5 or 6 years, if I recover back also, I might forgot the pain of this operation. Then if there is no good environment for me to really take care of my body, of my heart, maybe my heart will get blocked back very easily. So after that, I changed my career. I go and study. I'm quite fortunately, okay, because during that time when I'm an accountant, I'm working in a health food company, okay, which I have the chance to learn all those naturopathy, and then have a chance to go for another course of study of nutrition, okay, where I spend around 2 years. Okay, I go for another course. I study and get examination on nutritionist. Okay, so after that, I start my career as a nutritionist, and then I learned a lot from those Taiwanese, okay, those naturopathy on how to take care of body, and then I start my career until now. It's almost 16 to 17, almost 17 years already. So my heart actually, I've operated from there until now is around 16 years. Okay, so actually recently I went for follow-ups in General Hospital. They actually advised me to go for a half test on the that means to go for angiogram program organized by the hospital. One they allow me to. Of course, they have this is under like a teaching class lah. They want to see people after almost 20 years of heart operation surgery, okay, the condition of their heart, and then I'm one of the selected person. So next year, okay, they plan me to go for another angiogram process to see how is the condition of my heart. Okay, see whether got any narrowing of those bypass artery or got any blockage or not. If there is, okay, they will do something, okay, to help to rectify it. Okay, so I was selected to do this program actually next year. So next year there will be one day I will go to the hospital to stay for 2-3 days to go for this what we call the scientific crafting, okay, on the heart or how it performs. Okay, so these are three problems, and then the most popular among all the types of heart problem, and then mostly what so far what we note, okay, the most common those symptoms are related to this type of heart problem, or what we call the coronary artery diseases, which are because of blockage, and mostly, okay, because of the control of your high blood pressure is no good, high cholesterol, and then sometimes your high uric acid, which cause injury on the artery, and then long-term inflammation, okay, is happening in the artery there, and then this after a period of time easily it will cause the formation of the plaque inside the artery there, and then the narrowing of all this artery cause this problem. Okay, the supply of what we call the blood to your heart is getting lower and lower. Okay, so the common symptoms, okay, you are having this kind of problem, this coronary artery. Okay, number one, normally you experience if very early stage, from my experience, because I experienced all these symptoms before, I just let you know from the very beginning. Okay, sometimes you might maybe you won't have very obvious, okay, symptoms. Only you discover you got some problem when you climbing your staircase for, let's say, three floor. Okay, maybe after that now you find that your breathing is not so good. You have tightness, okay, on the chest there, and then sometimes it take quite some times for you to back to normal. That's all. Normally you thought that because of long time you didn't exercise, that's why your stamina is not that good already, and then you have this kind of experience, then you will ignore it. Okay, so from going 3 floor, okay, later on maybe it will develop into a stage which are more obvious one, maybe 2 floor, sometimes even 1 floor of climbing the staircase, you'll find your short of breath already. Okay, breathing is not as smooth already. And then it will get, okay, worse. Okay, sometimes even when you go on normal or fast walking, or maybe you carry something on your hand, then you walk faster, or after a certain distance, or you feel your hand become numbness, you cannot carry, and then your breathing getting very difficult. If you're forced to walk, okay, carry on, sometimes the blood supply to your brain gets lower, and then you will get this feel very uncomfortable, okay, like you want to fainted down. Then some people, they might have some pain, okay, start to happen on the chest there. Okay, but just to let you know, sometimes, okay, because normally the information and then the impression that we have on heart attack like those in the TV drama, okay, they will be very pain, okay, on the heart there. Okay, but okay, if you are not too serious during the early stage, it would happen. You won't feel like very pain one. Okay, you just feel uneasy, tightness, and then sometimes you just feel very difficult to breathe. Okay, this after you rest for a while, then it will go off. Okay, and then sometimes you might ignore it. Okay, you just thought you just too long or you did exercise. Okay, so this one of the symptoms, and then you have to see. Okay, sometimes it will cause when you sleep, you cannot sleep flat. You need your pillow need to be getting higher and higher, or with one pillow and then two pillow, or sometimes after a later stage, normally it will go to three pillow. Okay, without getting a higher position. Okay, you feel that your chest there is very what we call heavy. Okay, just like you are putting a very big stone on the on your heart there. You feel like very difficult to breathe, and then you feel uneasy. You have to sit up. Okay, and then the pillow have to be added up, or then only then you can breathe. Okay, so this is one of the major symptoms which normally we experience, and this is the way. Okay, sometimes it will slowly develop until you feel very difficult to breathe, and then you cannot sleep. Sometimes in the middle of your sleep, or suddenly you wake up because you cannot breathe. Alright, this kind of symptoms will happen, and then this is time some people they might even suffer from what we call water retention in the lung there. Okay, because when your heart cannot perform properly, cannot pump the blood out from your heart easily, then it will give problem to your lung one, because the blood inside your heart is from your lung. Okay, the lung after take all the blood after taking all the oxygen, the lung there, it will travel to your heart, and then your heart will pump it up so that the flowing won't stop. So all the time, those blood inside your lung, they will easily transfer into your heart, and then the heart will pump it up. So what happens if the heart cannot pump it up? So the blood inside your lung there cannot easily transfer to your heart. So when the blood cannot flow properly inside the lung there, so those water contained in the blood. So as far as we know, the blood not only contain blood cell, pellet, it also majority of the blood are water. So those water because of the pressure is become higher, so the water will leak up from the vessel inside your blood, inside your lung. So it will go out from your vessel and then go to the tissue there. So normally it will cause your lung the exchange of the gas, oxygen and carbon dioxide having problem because of the water. So you will experience water retention in the lung, and then the water, if the water become higher and higher, then you feel very difficult to breathe. Normally you can't breathe properly, and then you cannot sleep. So this is the time normally you will be admitted to hospital, and then when you go to the hospital, only then you discover that you are having heart problem. Okay, mostly of the heart problem are diagnosed because they have water retention in the lung, very difficult to breathe. Okay, and then start to feel uneasy in the lung there, even though there won't be pain on the heart, but cannot breathe properly. So eventually you will go to hospital. Okay, so the second one is shortness of breath. It means, even though you breathe very long, also you feel that there is no oxygen generated. Okay, and then all this the water retention may not only happening inside the heart there. Okay, sometimes your leg. Okay, because certain not only sometimes in your heart will have blockage, sometimes your leg, those quite big artery they will block also, and then your main artery in the middle of the abdomen there. Sometimes they won't flow properly. So all these are narrowing of the artery will cause let's say your like your leg, okay, and then your what we call buttock, you will get pain, okay, and then the back, okay, get pain, numbness, cold, okay, all these symptoms will happen, especially your right leg and right hand, okay. It will happen normally like numbness, okay, and then some people might experience cold because the supply of blood to all these places is not as smooth or very little. Okay, blood is going through all these things. Or some people, they might experience very heaty. Okay, heaty one mostly. The flow back of the blood is not going very good. Okay, for example, your vein, okay, where your blood is coming back or through the vein, or the vein is blockage, and then all the blood go to your leg already, then you want to travel back becomes very difficult because your heart also is not that strong already. So the actually the pushing, okay, the pumping of the heart is not that strong. So the blood flow from the leg back to your heart is very slow, and then easily it will get blockage on the vein, and then the flow of the whole circulatory system of your blood get stuck or somewhere is not moving properly. So this will cause numbness. Then eventually it will go to pain. Okay, so when we talk about your neck, okay, your especially your neck, your upper abdominal, and then your back, okay, especially the bone or the triangle of your arm one, the triangle bone, there you feel the pain, okay, and then normally your hand, you don't have the strength to carry very heavy things. Okay, so these are the major symptoms which indicate, okay, the heart having problem pumping the blood. Okay, so some people, they might experience sometimes the heart there maybe will have some what we call pain it suddenly happen like a needle or is putting on the muscle there, but it will go off very fast one. Some people they tend to ask me, is it because of my heart got some problem? That's why I experience this type of needle or poking my muscle or those kind of pain. Normally, okay, that is not. Normally there is not coronary artery. Okay, maybe there will be some problem with those problem. Those are what we call the nervous system problem, which affect the heart, or there might be some neural system got some problem, okay, in the transmitting, or sometimes just mainly on your heart, on your muscle after exercising or transmitting of this current in your muscle there is not regular, and then you cause this kind of like needle, okay, putting on the heart there, and then suddenly you feel a little bit pain, and then after that it goes off. Okay, so this still you have to take care, but you don't thought that is because of this artery blockage. Normally it's not. Okay, so the artery blockage, you have to careful, because all the while we thought only when there is what we call the angina. Okay, there is the pain is happening in the heart there. This actually is if really the heart attack is happening, the pain like those we see the TV drama one is very painful one. Just like you're holding something, and then you really give a very a heavy punch on your heart there. The pain is very heavy one. Okay, and then most of the people they won't experience this. Like for me, or during the age when I was around 38, 30 something. Okay, even though my high blood pressure start on the age of 28. During the time I'm at the counter, I don't know really taking care too much, and then don't have the knowledge on this. So I didn't control my blood pressure all those properly, and then I'm very fat. Okay, so during the 10 years, okay, it developed into this blockage of the three artery, but I never experienced, okay, a heart attack, a very painful like those we see in the TV one. I never experienced. Okay, I only experienced uncomfortable, short of breath, cannot sleep. Okay, the pillow become higher and higher, back pain. Okay, and then numbness on the hand when I walk too fast. All this I experienced before, but I don't have any experience on those heart pain which will make you cannot stand and then you have to go to hospital. I never experienced that. So we have to be very careful, because all the while we thought heart attack is like those pain. So those minor pain you will ignore it. You just thought after exercise or because of lack of exercise, or you got all those illness, those sickness. You just don't care about it. And then finally you wait until one day, okay, the heart become poorer, become worse and worse until the stage there, the heart muscle, all those are already damaged and spoiled, and then you have problem, very obvious water retention in your lung. Then only you find out that your heart got problem. There's sometimes it's quite late already. You want to rectify, it's not rectified. So this is called cardiac arrhythmia. I won't talk about this first. It's a irregular heartbeat, because this is a very wide topic. Also, symptoms are totally different from coronary artery. So we are talking about just now we already mentioned the artery which cannot supply sufficient blood to the muscle. Okay, and then this something will happen in the muscle there. So this is another type, okay, of heart problem which are related to the muscle of the heart, okay, which are mostly, okay, it happens because long term of high blood pressure, which we didn't control the pressure properly, okay, and then the early stage, okay, when the pressure getting higher, so the heart have to pump more harder, okay, and then the request of blood supply to our whole body maybe get higher because of it didn't really transfer and then travel nicely, and then this will cause, okay, your heart to expand sometimes. Okay, the heart become bigger. Okay, it will expand like this. Okay, dilated, what we call. And then this is a group of that affect the heart muscle. The what we call the ventricles will get enlarged. And then after the muscle become enlarged, the muscle will become weakened. So even though it enlarged already, and then more blood will flow inside here, but the muscle here will get weakened because of the enlargement, and then the pumping is not that strong already. Okay, so and then the volume become higher, so the pumping actually it cannot push, okay, the blood out effectively. Okay, so sometimes it cannot really actually fulfill the requirement of pumping the blood to go to the whole body, and then slowly, okay, the whole body, let's say your brain, maybe you get your blood not that much already, and then sometimes especially like your kidney, okay, you will eventually affected by your kidney also, because mostly the adjustment of our body, if the blood circulation is not so good or your blood volume is not that sufficient, the first thing the body will try, okay, to supply more blood to your brain, to your heart, to your organs, like your lung, which are very important in maintaining your life at first. They will get more blood, and it will slow down the supply of blood to your kidney first. Okay, so during daytime, especially when you have a lot of activities, so the blood will be more utilized in your brain, your lung, or your liver there, and then less will be supplied to your kidney one. So after one whole day, okay, of activities, okay, you will see that because the heart are also not that strong already, so the pumping is not that strong, and then furthermore, the blood is not supplying to your kidney that height. Sometimes the kidney building of urine is lesser one. So you experience problem lesser urination. Okay, and then up until evening, when your activity or daily activity is getting lesser, you rest, and then because of the heart don't have to pumping so much of blood out to your brain, or those, because of the activity is getting lesser, so the blood will diverted to your kidney in a higher level, and then sometimes you will rest also, and then the blood is easier to reach to your kidney, and then all this blood will carry the water, and then the waste to your kidney, and then the kidney will start to process. So after in the evening, you might feel that you start to urine more in the evening, and then if you drink more water, and then at the night, and sometimes midnight also, because at the night when you rest, more easier for the blood to flow to your kidney also, because you are lying down. And then more urine will be created, and then more waste during that time. The repair of your body is happening. More waste have to be flushed out, so your urine will goes up. So heart problems they will come another symptom, what we call water retention in the leg or in your ankle there. Mostly those having this pumping problems is not efficient already, then you will have this kind of problem already. That means some of the heart muscle is not working as efficient as what we think. Maybe your heart pumping the strength is getting lower already, so the blood flow go to your leg easy, but come back it's not that easy, so it will cause water retention on the leg there. So majority during this what we call evening time, you find that my leg all start to swollen, and then water is retained on the ankle there, and then after you rest, in the evening, or you start resting, and then the urine become more. After you urine more, then the swollen become lesser, and then at night, after one whole night of rest, then the next morning you'll find that the water retention will goes off. So normally during evening it gets very tight, very heavy on the leg, and then water retention is starting, and then the next morning it disappears. Normally it indicate your heart is not that strong already. So some people, they might thought that the kidney got problem, because mostly water retention caused by the damage of your kidney will cause water retention the whole day. So those are daytime accumulate, evening get swollen, get water retention. The next day it disappears. Normally is your heart problem. So this is the first stage. What we call the dilated cardiomyopathy. The ventricles enlarge and weaken already. So this is the first stage. So in order to rectify this problem, normally the heart have to do some adjustment. Normally what the heart do is to make because the enlargement of the ventricles, normally or eventually it will goes to the hardening, okay, and then maybe the thickness, okay, enlarge and thickness of the muscle in your heart here will get thicker and thicker. Okay, this thickening of muscle, sometimes it will need more blood supply to all these tissue, all these cells in the what we call the muscle there, and eventually because of your artery problem, the supply of blood are getting slower and slower. So all this build up on the wall, or all this muscle build up, and eventually it will goes hardening, and then slowly the strength would not be that good. So from this hypertrophic, okay, hypertrophic, that means the enlarge and thickness, okay, become higher, then it will slowly develop into restrictive ventricular stiffness. That means the muscle here becomes stiffness, and then it cannot pump properly already. So the pumping, the strength will get lower and lower. Then eventually all this muscle will get lower and lower, and then get damaged, and then it will develop, okay, until this stage, what we call the heart failure. That means all the muscle here actually is pumping, but there is no strength. Okay, the blood cannot flow up properly. Okay, then it go into the stage of heart failure. So for those who got artery problem, coronary artery, and then they didn't go for treatment in the early stage and drag too long, sometimes it will cause heart failure. Just for your information, myself, okay, I'm having this problem also, okay, because during the stage of when I discover I got artery problem, already dragged for quite some times, and then when I went for operation also, I queue, I wait for few months, almost half a year, trying to do other naturopathy ways, okay, to trying to rectify the things, but unfortunately because of tree also block, it becomes very dangerous for me if I didn't go for operation as soon as possible. Okay, so this is the difficult part of those people who are having heart problem, because sometimes let's say especially those have blockage on the three main artery one, okay, because of three also got problem. If let's say heart attack is happening during that time, if you are lucky enough, maybe it only block one places, okay, you still only damage on certain part, or you still manage to alive, okay, to maintain your life. But if you are not lucky enough, it happen, or maybe in two also got block, okay, and then suddenly a very strong heart attack is happening, okay, because heart attack, or when the strong heart attack is what we see in the TV one, once it happen, okay, your heart you still will go into a stage where it will eventually pump the irregular heartbeat, will cause a very heavy damage on the heart cells. So even sometimes after you went for a treatment in the hospital also, or after that, you go for bypass or go for balloon, okay, to get through, okay, the blockage, but your heart cells already maybe seriously damaged, and then the heart cells is not easy to grow back. Okay, so just for your information, heart cells is one type of cells which will not easily grow back. Okay, so from the survey, from the research of the scientists, normally a heart cells totally want to change the whole heart cells, it will take almost 20 years. So in our whole life, the heart will change only around 6 times the heart cells. So for those people who have very serious damage on the heart cell, you want to wait for the recovery or regenerate of the cells. Normally, you won't have the chance. Okay, because in the process or during the recovery, maybe heart attack already start happening, and then the serious heart attack will take your life away easily. So if you are not lucky enough, serious heart attack is attacking you, or within a few minutes, you will die off. Okay, I'm very actually quite concerned on this for those who are having already having heart problem because of very afraid of facing you have to go for operation, or maybe sometimes because of financially problems. Okay, you try to avoid, you try to delay maybe later stage, and then you try to go for alternative solution. Okay, then you will just drag, and then if you are not lucky enough, what happened in the period when you are not doing some things, okay, to kill it, and then the heart attack is happening, okay, then you won't be able to continue your life, or sometimes it will bring you very bad side effect after that. I've gone through a few cases where people having problem like myself have to go for bypass one because they don't know how to because of financially it costs a lot of money, and then if you go to hospital, general hospital, sometimes you have to queue, and then they have a wrong impression. Okay, maybe they have to queue very long, and then they cannot wait, and then they don't have money also. Sometimes they might tend to go for other types of alternative way, and then in between that, the heart attack is happening. I went through few patient is having this kind of problem, and then they pass away. This is very very sad to hear that, because this can be rectified because of the advance of our modern technology nowadays. To rectify the coronary artery problem is no longer really dangerous, or very high percentage of death. Okay, it's not in that case already. Not like 30 years, 40 years ago, if you have a heart attack, or very difficult to cure. Nowadays, okay, to rectify the blockage of the artery, the during that period, then it caused death. The percentage is very very low. I think it's lower than 5%. Even though there is risk still, but it's lower than 5%. Okay, even like open heart, okay, bypass, okay, the chances of failure of the surgery is not very high also. 5 to 10% only. I think it's lower than 10%. If I'm not mistaken, during the times when I start, I'm doing the operation, it's slightly higher than 5%. I think around lower than 8% during that time. I think now the technique is become more advanced. Okay, I think the chances of failure is getting lower. And then especially when you're still young, the chances of healing, rectify back is very good one. Okay, so you don't have to be too worried. And then secondly, if you are financially got problem, or if you want to really go for operation, this just let you know there are welfare organization you can really go and apply one. Okay, for example, government like those days in IJN, there will be a department called the kebajikan where you can apply if you really cannot afford. Okay, you can go and apply. Normally the officer there will ask you how much you can afford, and then normally when we apply, we will say maybe we can pay only 10%. Okay, so they will do it for you. okay, and then they will charge you around, ask you to pay around 10%. Some people, if they cannot afford, or like for example, my cases, I go for three artery bypass, and then it cost me around, if actual bill during the time, it cost me around 50,000. Okay, but eventually I pay only 5,000. I went for to apply for the kebajikan also. Okay, and then it is allowed. Okay, but the reason change in the policy of IJN, they have changed, because IJN already I don't know whether it's half privatized or fully privatized now. Okay, you have to be a government servant, or only then you can go, or you must be recommended by general hospital. Nowadays they have concentrated on all these heart patients in this Sedang General Hospital. Okay, Seri Kembangan Sedang Hospital. Okay, a very big hospital there, concentrate in the treatment of heart one. But because of the change of policy, KL Selangor, and then this Negeri Sembilan, Melaka, those patients also refer to this Seri Kembangan Sedang Hospital. That's why it's really a lot of patients. Okay, now this hospital are specialized in heart one, so you can go there. Okay, if really they have to put you in a long queue one, you can ask them to write you a letter to refer you to IJN. Okay, if you are doing in this Seri Kembangan, of course, okay, is if you are Malaysian, you can get free one. Okay, but if you are doing in IJN, those days when I'm doing, I still can get kebajikan to support. I pay only 10%. Nowadays, you need to have a referral from this Sedang Hospital. Okay, and then you have to see the doctor there. And then if you are very serious, and then your symptoms are quite often it happens whereby you have water retention. The doctor will write you a letter and refer you here. Maybe you still have to pay a little bit of money if you go through the kebajikan. But so far I know there are still kebajikan there. Okay, you can try, especially those who are facing financial problem. Okay, you should don't delay because of money. Okay, you and then don't because of scared of all this kind of treatment, especially if you are going to general hospital. If you are still under queuing, okay, they will give you medicine to avoid, okay, to reduce the percentage of heart attack one. Then please, okay, follow the instruction properly, because during that time you have to control nicely your your heart pressure, and then your diabetes, and then your high cholesterol. Otherwise, the heart attack will easily happen. And then it will you have to pay for that. Okay, it will be serious if you are not lucky enough. Okay, it will kill you. Okay, so please don't simply ignore it, and then you are taking other remedy or other way of alternative medicine. For example, let's say we encourage you to use IM laser, but please don't take away all your medication, and then without the knowledge of your doctor, you throw away all the medicine and then you use IM laser. It will be very, very dangerous one. Okay, so I don't advise. I will advise you to use together with the medication to proper control, and then you have, okay, a higher rate. And then sometimes if you want to have other alternative like CVA, it's very good in softening or in reducing all this plaque or dilating. And then you can go together, but you have to go together with all the medication, and then you must let the doctor know also. Okay, so in that case, maybe during the period when you wait in your queue, okay, for operation, then maybe after a few months or half a month, half a years of waiting, then eventually when you want to go for operation, you don't have to do anything. Okay, is happening, and then it's true story. Okay, so many people they experience this, but I don't advise you to go without the medication because it's too dangerous. Okay, so this is another type of heart problem. Okay, which we call the pericarditis or carditis. Okay, so this is the infection. Normally is happening on the there's a layer, a very thin layer of sac that surrounds your heart. And then there are two layers in between. They got liquid inside. So to reduce the actually what we call a small amount of fluid between them to prevent this friction when the heart is beating. Okay, so this layer sometimes it might be infected by virus or by bacteria, and then inflammation is happening in the heart. Okay, and then the inflammation will cause a lot of problem in the rhythm, and then sometimes it will cause chest pain, okay, heart attack to happen also. So we are trying So for those okay who are having problem like how we call it here, numeric this those joint pain because of the disorder of your immune system. Sometimes it will attack, okay, and then your all the bones, and then there will be what we got the those factors inside the body which will cause this to happen, and then sometimes it will cause inflammation on your joint, and then these factors, okay, it will cause sometimes problem in the heart also, okay, and then this even sometimes in the brain, okay, and then inflammation is happen, and then is life threatening also. We have to avoid, and then especially like COVID-19, the attack of all these virus sometimes. So far, I've seen some report. Eventually, those people who are having heart problem, they will get into problem, okay, because of the infection. So this is okay, and then if you are having this kind of infection, especially on the heart there, of course you will have fever, okay, high fever, and then those symptoms that you experience when you have a problem in the heart muscle and then the coronary artery. Number one, the shortness of breath. Okay, you become very weak, fatigue, tiredness, and then water retention on the leg, on your abdomen, and then maybe the rhythm of the heart beating is changing. Okay, and then you might experience coughing or a very long term of coughing and then cannot recover properly. And sometimes it will cause problem on your skin also. Okay, especially for those who are affected your lung one. Okay, lung when the heart got problem, the lung also got problem. The lung got problem, normally your skin will reflect. Your skin also will have problem. Okay, so because the lung and the skin are all related. Okay, and then your colon also. So your lung, your skin will be maybe will have rashes, okay, all those problems. Then you have to take care, and then you will have serious high fever. Okay, and inflammation is happening. So this is another few types of when we discover those baby, they are mostly genetically have problem. This when they during the age of maybe 1 or 2 years old, okay, doctor will find that this baby they got problem. Okay, there are two types. mostly are genetically, okay, when the building up of the heart is not in a proper way. Okay, the first type is called the pattern foramen ovale. Okay, I don't know what language is this. Not easy to pronounce also. Okay, there is naturally, okay, there will be a small hole in between your left heart. Okay, your left heart and your right heart. Okay, in between there will be a muscle which divide it into two. Okay, so your what we call there will be naturally a small hole here where but when the baby was born, okay, and then when the baby start to use the lung to what we call breathing, okay, to do the breathing, so this hole will automatically, because of the pressure, it will close up, okay. But when you are in the stomach of your mother, okay, this is a small hole whereby the blood can flow through, okay, especially actually the baby is using, okay, these places, okay, to join, okay, to the mother, okay, with the mother, so that the mother's blood supply or the supply of oxygen, and then the nutrient can go through from here into the baby's body. Okay, so but once you are born, when the baby start out to use the heart to breathe, it will eventually close up. But some people, okay, some kids, I don't know why it didn't close up properly. Okay, then there will be a problem. Okay, once we start out to use the lung or to breathe. Okay, once it cannot close up properly, the pumping will have some problem. Okay, so this is the main problem. Okay, once baby born, but normally the doctors won't do much on this, because eventually, or maybe it will take some time for it to close it up, but eventually it will close up. Okay, slowly, maybe 2 years old, 3 years old, it will close up. So no need any operation on these things. Okay, but you give some symptoms. The doctor worried what is happening is the next one. There is this, okay, what we call there is a hole, okay, in between here, the muscle here. Just now we are talking about the upper part. This is the lower part, where your heart are divided into two. Okay, there will be a valve in between here. So this part, the muscle here, the wall here, there is a hole, didn't close up properly. So the blood contain no oxygen and got oxygen, they will mix up inside here. And then because of this hole, sometimes the heart, when it pumps, it cannot pump the blood out effectively because of the hole here. What we call lao hong. Then the strength is not that good already. Okay, so this is where doctor have to rectify this. Okay, because it will close up so easily, even though some baby eventually close up back, if the hole is not back, but most of the baby cannot close it up automatically, so they need surgery to what we call cement it. Okay, so so all these baby, if they have this kind of problem, maybe they have to go for few types of operation in the whole life. Okay, I still remember during the time when I went for operation, the next bed, there are two kids around. One is I think around 10 to 12 years old. They are operated when they are 2 years old. Okay, to fix this, to cement the hole. But because the growth of the heart, okay, after certain years, the hole start to begin to leak again. Okay, so during the age of 10 or 12, okay, it's getting worse, and then they have to go to another operation. Some even when they reach the age of, let's say, 18, 20, maybe they have to go for another round. So see, depends on the condition and then the changes, okay, in the enlargement and in the growing of the heart, and then how is the growing on the semen there, and then this will give you a very clear symptoms if the kids are having this problem. Okay, and then this have to go through surgery if they have. Number one, okay, normally their skin will look like gray color or blue color. Okay, or maybe sometimes we call it purple. Okay, we change to purple color. Why? Because the blood there, those blood without oxygen are mixing with oxygen. So all the while we are looking the skin's color like normal like a little bit yellow because our skin originally are yellow one due to the blood, so it looks like a little bit of darker, okay, like brown color. But what happens if the blood is full of carbon dioxide, lack of oxygen? Normally the blood will reflect like purple color. Okay, so if the blood become purple color, it indicate okay, all the blood inside the body contain very high carbon dioxide and very low in oxygen. Okay, of course, exchange of the gas inside the body is no good. And then definitely there will be swollen or bengkak, water retention in the leg, abdominal, okay, and then the eyes, okay, and then especially with feeding the kids, then the infant, they have shortness breathing, and then they will grow very slow. That means no matter how they eat, also they would really grow very slow because of lack of oxygen. The build up of the muscle or the bone become very slow. Okay, if a little bit age growing up already, then they will have problem in exercising or active moving will cause them to breathe very difficult. Sometimes they will get tired very fast. And then, of course, easily hand and then the ankle and then the leg get water retention. These are the major symptoms, especially those kids are having. Okay, so these are the two, the few category of heart problem, and then the symptom they are having. So in order to avoid heart problem, what are the things we have to really take into consideration and really take care in the early stage to prevent of getting heart problem, or maybe if you already have heart problem, how to reduce the risk of getting heart attack, okay, how to maybe reverse it, okay, to make sure your heart will go back to a better position. Okay, so these are the few things normally, and then these are the few things actually I've mentioned many times. Okay, in order to prevent and to avoid the happening of heart attack, the first most important thing is to control your high blood pressure, your diabetes, your high glycemia, okay, and then your high cholesterol and your high uric acid also. Okay, why uric acid is very important? Because uric acid might tend to crystallize with a combination of this what we call the cholesterol, and then sometimes the minerals, okay, and then it forms crystallize, and then sometimes the pushing, the crystalline or the blood will cause blockage on the or the artery or the vein, and then make the increase of your high blood pressure, and then your heart will tend to have have to press very hard, and in the long run, the heart will expand. What we call the dilated problem will happen, and then the heart muscle will get weaker, and then it cannot really give the strength to push your blood properly, to give a good strength, to good push to the heart flow. So eventually the heart will flowing the blood flowing very slow. Once the blood flowing really slow, it will cause water retention, and then easily those fats, those waste inside the blood, they will combine, and then they will form crystallization, and then it will go into a very bad cycle. Blood will happen, and then the blockage will be higher, and then the pressure will get higher. Then eventually the heart will have to from expanding, and then it will become thicker. Then thicker after working, sometimes the muscle will become stiffness, and then the strength of pumping getting lower, and then the damage on the tissue and on all the cells in the heart there, because of the lack of supply of oxygen and nutrient, the heart cell start to die, and then heart failure slowly will develop. So this is the three things. That's why doctor is very particular on controlling our high blood pressure, high blood sugar, and then high cholesterol, because this will develop in the later stage your heart problem. Maybe it will take you 5 or 10 years. Some people, if maybe with 10 years nowadays, I see mostly if you have high blood pressure, you didn't control properly, or maybe after 8 years or 10 years, you have a problem in your heart. So cholesterol is one of the factors, even though it's not the main factor. The main factor is because of inflammation is happening, because of your high blood pressure, cause damage to all the arteries wall, and then the repair of the artery wall will make use of cholesterol also, and then this go into the inner layer of the vessel, and then it form a plug there, and then thickening of the layer of this plug, and then the pathway of the vessel become narrow and narrow. So other factors, risk factor, of course we know this obesity is one of the things we have to take care, maintain an ideal weight, according to your height, control your eating, because those who are very bad to the body one, for example, even though we say that forming of blood is not mainly because of cholesterol foods, we still have to control foods that is high in cholesterol, even though there is not the main material which cause the blood forming, but if it is too high, it's still we have a higher chances of forming. So we have to control the intake of oil, try to take good oil. So your LDL, your HDL have to be controlled. HDL higher, very low in LDL, so that it won't easily get caught in the vessel there and form the blood. Of course, this bad habit we have to avoid, like smoking or alcohol too much. All this will cause, and then eating like those oily food, frying things, all this will cause inflammation. This oxidation is happening inside the body, which easily will form all the blood hardening of your blood vessel. So lack of exercise is one of the things which we need to. These are the 6 things we have to really manage it nicely. From here you can see manage your 3 high. Then of course I add here the high uric acid also. Then you have to make sure to improve your blood viscosity. That means your blood shouldn't be too thick. Very low in water. very high in waste, like toxin or all these things which are supposed to be flushed out from the body, but it's still maintained in the blood there. Too much of oil, fats inside the blood there. Okay, viscosity of the blood is no good. Okay, all this is to avoid thrombosis is happening. That means the blood, the formation of the crystallization and then the thrombosis, okay, in the blood cells, in the vessel there. Okay, can be reduced if your blood become very clean, flow very fast, contain sufficient water, so the crystallization won't be able to form so easily. Okay, so the improvement of your blood circulation, of course, it will strengthen the supply of oxygen and nutrient to all your cells. So your organs will perform better if oxygen and what we call the nutrient supply to the cells are getting higher. And then, of course, encourage in your food. Okay, please take more foods that are high in antioxidant. So to avoid oxidation free radical is accumulated inside the body, and then which will cause hardening of your blood vessel, all those problems. So this, of course, it indicates you have to take a lot of fruits and vegetables, which are mostly high in antioxidant ingredients, a lot of vitamins, a lot of nutrients, like minerals that we need in the metabolic and in the generating of energy in the cells. Okay, and then we are too low, okay, in the consumption of all this category of foods. We are too high, okay, in taking meats or those, and then carbohydrate are sometimes also very high. So the last thing, make sure you can sleep nicely. Sufficient sleep, adequate sleep is very important, because most of the times our body repair during the time when we are in sleep. Okay, so a deep sleep will encourage the release of growth hormone inside the body, which are responsible and in the activation of our what we call the stem cells, and then the growth factor, okay, which are responsible for the repair and then regenerating new cells inside the body. So without having a good sleep, normally your growth factor won't release so much, and then your body cannot be repaired in a perfect condition. So earlier aging, okay, and then incompletion of the rest of all the cells generating of the energy, and then sometimes the low in energy, or for example the ATP generating inside the body is getting lower. So your inner doctor, what we call the inner doctor, that is the automatic function of self-repairing inside your body, it cannot work nicely. We say the inner doctor is lack of energy, and then you don't give the timing and then a good chance for your inner doctor to repair your body during the sleeping time, because you didn't sleep when the doctor was supposed to start operating all the mechanism of repairing inside your body during the time of sleeping, especially from 11 up to 3 o'clock in the midnight period. You are supposed to sleep, okay, to allow, okay, the body to really do all the what we call repair, regenerating, okay, of all the cells inside the body, so that the next morning the doctor will deliver a new you. Okay, all the cells are already repaired. Some those are got to be replaced one. The new one already generated. The old one in the morning you flush it out. Then it will be a new you in the next morning. Okay, so this is the process which we are supposed to do if we want to avoid this heart problem. And then this is why, okay, this Vantros, we introduce this few product range, which are specifically designed, okay, to improve all this, to what we call to fulfill all this requirement. You can see clearly, okay, the IM laser that we have been in the market for the last 5 to 6 years, which give a very good response, and then very good result in improving the blood circulation, okay, the heart, all these problems, and then those problems are related to what we call neural system, and then the hormone system. Okay, the light produced, okay, by this IM laser, okay, which we call the 650 nanometer red light, which are specially and approved and confirmed by the scientists, which are very healthy for the body once it absorbs it, and then it will help the body to do a lot of magic things inside the body. Okay, first thing, okay, it will actually activating all the enzyme inside our body once we receive this light. Okay, and then we are using technology, the laser technology. There are 6 laser heads inside here, inside the watch here, which produce the light can be penetrated by using the laser theory into our bloodstream, whereby our red blood cell will absorb, okay, the light, which contain, okay, what we call the photon inside. Okay, so by using this IM laser, we are using the laser to penetrate the light, and then it go through the body, and then when it reach, okay, go through the blood vessel, it reach the red blood cell, the photon, okay, will attach on the red blood cell, and then it will follow, okay, the red blood cell, then travel to the whole body. And then some of these photons will activate, okay, the enzyme inside your blood here. And then all these enzymes are responsible to make sure, okay, your blood cells is clean, and then it will stick together. So sometimes, because of certain reason, okay, the activation of all the enzyme inside your bloodstream, normally due to low temperature, sometimes basically lack of light, okay, you expose inside the sunlight, there is 650 nanometer red light, because nowadays we tend to run away from the sun. Very often you don't go for sun bath in the morning and in the evening, which scientists have already proven that there is very benefiting the body because of the light that is inside the sun. All these photon inside the sun during this period in the morning and in the evening is very warm and very healthy, and then there is not much of bad light inside the morning sunshine. So we suppose, okay, should expose, okay, to this type of light in the morning. Okay, is very good. Then the design of our body are eventually very sensitive to this type of light. So when we input, okay, by using IM laser, we input the photon, so the photon will activate the enzyme inside our whole body, okay, especially in the blood here. So the activation of all these enzymes, you cleanse your blood, so that your blood will stick together, and then it will improve the flowing of the blood. So the circulation of the blood will get higher. So in other way, okay, the collection of oxygen from the lung, and then the transport of nutrient inside the blood there will go faster and easier to all the cells. So when the cells receive all this material, okay, and then the light, so the light will go to the cells, and then it will go to the mitochondria in every cells, okay, which are responsible to generate this what we call the energy for the cells, the ATP. Okay, so by the photon will activating the enzyme inside the mitochondria, so to speed up the process of generating ATP by using water, nutrient, and then oxygen. Okay, so all this supply will increase, then the generating of ATP will go higher, and then all the cells will get more power energy. Okay, powers up, and then we know that all the organs inside the body are made up of cells. So the organ cells become stronger, of course the organ will function better. The organ will do its works automatically better. So this is how it happens. And furthermore, in the process of generating this ATP inside the body, the light will encourage the cells to produce these two things also, which is nitric oxide and then ROS. These two things, first of all, is very good. Actually, it's a very effective transmitting agent. That is very important, especially in the neural system, to transmit information. And then inside the cells, okay, in the process of generating, okay, the ATP, they are involved in so. And then nitric oxide are very strong reaction, especially inside the vessel to cleanse, especially for those who are having problem of forming of the blood or those or thrombosis inside the this nitric oxide is responsible to slowly dilate, okay, all these things and cleanse your blood vessel, and then after a certain time, the strengthen, okay, the muscle of your blood vessel, so the softening of the muscle of all the blood vessel, so you have a very good elasticity in the blood vessel, and then because of the increase of generating of all the cells inside the organ, so the whole body, all the important organs inside the body will be repair, regenerate. Okay, of course, it depends how easy to repair. Like your liver is much more easier to regenerate the cells compared to your heart. Your lung also, the lung cells is quite easy to replace one. Okay, these two parts, the heart and the brain, very difficult, especially the brain. If you experience a stroke and then damage on the brain, it's not easy, okay, to build back or to generate new cells inside the brain. Okay, that's why the IM laser, we purposely designed it is another line whereby you can put onto your nose, so that to let more light will be delivered through the capillary inside the nose there to your brain, so that the brain cells can receive all this light, and then it will increase the generating of the energy inside the brain cells, so that to maintain the youthfulness of the brain cells. So then when there is damage or injured of the cells, maybe we can still repair it, but if the cells unfortunately died off, it's not easy to rebuild a new cells one, especially inside the brain there. So we must take care. Once the die of brain cells are getting higher and higher, maybe you will have problem in loss of memory, Alzheimer, all those problems, Parkinson, which are related to the brain's activities. Okay, so we must take care, okay, on the brain cells. So we must use on the nose every day, at least you maintain 2 times using on the nose, using the line to provide more light to your brain here, to make sure your brain get the light, and then the generating of energy is higher inside the brain cells. So if all the organ they can function better, of course, the coordination between all these organ, okay, we call the system inside the body, like for example, your neural system or your hormone system, which will affect the whole body also, especially like some of the heart problem, they are related to hormone also. So if your hormone is imbalanced or the secretion of certain hormone is not that right, okay, like adrenal hormone, okay, which if release too much, your heartbeat will be high, faster, okay, and then the transmitting of signal inside the body, the neural system, if let's say the electronic current during the heart pumping, okay, which are from the control of the neural system, which will build a current or deliver to your heart to make your heart to pump one. So if all this signal cannot be delivered nicely or properly, or there is a growing of unnecessary, okay, wire, okay, what we call the receptor on the current, and then it cause some problem in the rhythm of beating of the heart. Then your heart will have other types of problem, which we will discuss later. Okay, so this is how IM laser. You can see easily earlier when we talk about cleansing the blood and then maintaining the blood vessel, okay, and then rebuild all your muscle, especially inside the heart. This all can be done by using IM laser, and then it will help a lot. Of course, if you want to make a better, okay, regrowing, okay, or regenerating of cells, of course, sometimes we might need some extra, okay, vitamins or ingredient to boost up, okay, the effect of regrowing. Okay, so that's why the company come up with another new products we call the CVA, which emphasize, okay, on the growing and then the repairing or antioxidant, okay, and maintaining the youthfulness of your cells, which we combine wild ginseng, which is very, very expensive one. Normally, we won't be able to take wild ginseng because of the cost, and there is the first reason why we won't take ginseng so often, even though we are knowing that ginseng is very good for the health, but we won't take it so often because it's too costly, too expensive. Okay, but nowadays, due to technology advancement, we are able to use high technology to produce, okay, by taking the stem cells from the wild ginseng, and by using the stem cell, we actually produce this what we call the CMC cells of the wild ginseng, which will produce a lot of rare ginseng nosai, which are the most important ingredient inside ginseng, which give health benefit to the body one. So by using a technique which are worldwide patented, okay, technique of using stem cells of ginseng, we are able to produce all these cells and then make the cells to produce a very rare ginseng nosai, okay, which we call the phytochemical inside the ginseng. Okay, for example, like RG3, RH2, all these are scientifically confirmed and certified by all the researchers that it is having very good effect in boosting, stimulating blood circulation. Actually, this controlling the growth, okay, of all the cancer cells, suppress the growth of cancer cells, and then a lot of good benefit, especially to the recovery of cells' life, to expand, prolong, okay, the cell's life, and of course, those give a very good benefit to some of the organs, especially like kidney, like our liver, strengthen the cells there. And then with the combination of these three very important ingredient, what we call the sipaton. Okay, this is the sipaton, which is a type of what we call from the seed there. It contains a very good fats. Okay, unsaturated fats, which are very good in helping the body to produce HDL, and then some of the ingredients, okay, like vitamins, amino acid, which are very good for our body. Okay, and then this is all these three actually individually, they can be produced into different type of health food products. All the while, or in the market, they have been selling very well also, like sipaton products, and then berry. We have selected aronia berry, which is very high in all these phytochemicals and very good in antioxidant. Like button also very high in antioxidant. Aronia berry also very high, and then this is what we call promo. Cannot pronounce everything. Suddenly don't know how to pronounce everything. Okay, pomegranate, something like that. Okay, this is a type of fruits, okay, which are very high in all kinds of vitamins, especially like vitamins K, which will control the viscosity of the blood one. Okay, and then aronia, it contain very high this what we call the minerals, we call the manganese. Okay, all the combination will help. They're very high antioxidant. They will help to preserve the use of this ginseng, because ginseng oxide is very rare and very expensive. The value is very high. We must make sure the absorption, and then it can be stored in a liquid form for certain times, so that high antioxidant can prevent the oxidation to happen, and then it affect the absorption of all these RG3, RH2, RAM, and this ginseng oxide. So this formulation is very important because it has been designed in such a way so that, okay, the absorption of the ginseng oxide can be in the highest, the optimum rate, beside all the vitamin and then the minerals and then the all the nutrients that we need are contained inside the other trees, can be delivered to our body, okay, to the cells. Okay, from here you can see that okay, because there are some teacher, okay, some guru already mentioned on this products earlier in details, so I just jump off. Okay, you all can refer back to the topic when they are talking about this product. So these products, when we combine together with IM Laser, will bring you very good effect on improving your blood vessel, your quality of your blood itself, okay, the viscosity of the blood, and it improve all the cells energy, so you have a chance, okay, to maintain a better heart cells. Okay, so the energy of the heart is better, and then all those problems related to the electricity, the current, okay, and then the neural conduction transmission inside the body can be, okay, improved by using the combination of IM Laser and this CV8. Okay, and then the effect is no 1 + 1 = 2. Normally the effect will be 1 + 1 maybe equal to 11. So the effect of each other, so the function of regenerating the cells will be higher, and then to prolong the lifespan of the cells will be greater if we combine together, when you use together, and the whole body will regain youthfulness better. Not only regain the health, but it will reverse back the aging. It will make you look younger, the youthfulness is getting back, so the whole body become a new one. Okay, because of the regenerating, because of the help of stem cells, and then the a good sleep, the help of your all the growth factor, eventually you will getting a healthier and younger again. So of course, if you want to further improve in your diet to have a better this elasticity improvement, also you can include all these foods and then food into your diet, also into your normal meal. I will encourage, because the 3 meal you have to eat something. Okay, put all this into your meal. Okay, so it will again further enhance the improvement which will relate to your blood, and then your blood vessel, your heart. Okay, your health actually it begins from your heart, then all the nutrient and then oxygen supplied to the whole body, to all the organs. It begins with your good health, blood flow. Without a good blood flow, this is the basic. So the delivery of oxygen and then the nutrient to all the cells inside the body will be lesser, and then it will affect the lifespan of all the cells, because the generating of the ATP or inside the cells there is getting so slower. So this is the first thing. If we want to have a better life or healthier body, we have to do. Okay, you can include all this inside in your diet also. So my explanation will be up to here only. I have taken more than a longer period, because sometimes when I have to take into English, I have to speak very slow because of the conversion. So I stop here. So if got any question you want to ask I will give you some times. Okay, even though we are already 10:35, we have 5 minutes more than actual times already. But okay, if you want to ask a question, I still give you another 10 minutes to ask.
Okay, thank you, Mr. Lee. Wow, well done. The 11 participation, the participants still here with us. We still have 11 people with us, Mr. Lee. Don't worry.
Thank you so much. Not like earlier 31 still remain 31
The 13 is still remain 13, but now it has 11. Okay, we have it. So, do you guys still have any question to ask Mr. Lee? Do you want to raise question? You can actually raise your hand. I can unmute you. Okay. Anybody want to ask question? Few 3 minutes. You just raise your hand. Below. Joanne said thank you, Mr. Lee. Joanne, you want to ask question or not?
So for too long of explanation, I have to talk very slow.
Okay. Anybody want to ask question? Okay, so if you have no question, then I want to tomorrow is what 1st of August. So with the COVID-19 around, do remember to wear your mask. And I think lastly, I want to remind everybody about this topic of the heart problem. I have a customer which he bought IM Laser 1 year ago. So he didn't seriously, because Eng Siu brother-in-law, he bought 1 unit of the IM Laser and not using it frequently, I would say, not to say properly, and also properly. So not frequently. So last month when I met him, when I went for servicing, I met him. He actually diagnosed of 90% tree blockage. Wow, that's I don't know what to say. I'm speechless, because he bought that unit for a year ago, but he didn't really believe IM Laser can help. So when we went back to service, we told him when this IM laser, when our boss CEO started, why he wanted to do this because of the heart problem also. So I hope you guys go and please spread this message to all your friends. But because it's too late, the doctor has already given him an appointment to go for a bypass. So sad to hear that. He had the device at home, but he didn't use it. Okay, he didn't even know where's the nasal line. So we have to go and look for it. It was totally very nicely bundled up in the IM laser box. So do if you have, tell it to your friend, or your friend has things you and bought the device, do really go and service them and ask them to come and listen to Mr. Lee. We will be back on air again next Wednesday with Mr. Lee in the Mandarin session, and also English on Friday. Okay, so I think it's a bit late. Thank you very much for all of you for staying with us until now. Thank you very much, Mr. Lee. He has did a good job. Thank you, Mr. Lee.
Okay, thank you,
so
everybody.
good night, everyone. Okay, would you like to say, switch on your screen and say goodbye to Mr. Lee and to me? See you next Friday. Do bring your friends and stay safe, yeah? Okay, thank you, Linda. Thank you, Florence. Thank you, Chong Kok Wing, Mr. Chong. Thank you, Teresa. Hey, somebody raised a hand. I want to. Okay, Linda, you want I unmute you?
Then unmute me. Hi. Thank you, Mr. Lee.
Hi.
Very informative. Yeah.
Okay, thank you.
It's very interesting.
Thank you for having the patience to stay until the end.
It's a waste. It's a waste. A lot of people didn't